Welcome back to Close Up and our extended conversation with Governor Chris Sununu. Governor, you've been in an ongoing battle with hospitals on a number of fronts, but in particular over the Medicaid enhancement tax, which generates millions and millions of dollars. This is kind of obscure. The state brings the money in, it uses it to leverage more federal funding, and then sends the money back out to the hospitals. Right. And there's been a huge debate over the cut that the hospitals get back. I guess the question is this, do you think the hospitals are trying to wait you out, essentially say, hey, well, he's going to be leaving, we're going to be able to try to...
Oh, no, this goes into effect next week. No, it goes into effect July 1st.
But they pay the tax in the spring, right? So they could...
Yeah, well, look, the next legislature can do what they do, but we're setting all of our new Medicaid rates, which are going to go up, by the way, to allow nurses to get paid more, social workers to get paid more money into the community mental health systems, community-based, federally qualified health centers. Look, this is an awesome opportunity for 21st century healthcare. Do we want to just pile every dollar we have back into the old-fashioned hospital system where every time you stub your toe, you're in the emergency room, right? For years, they said they didn't want that. They've actively said, we don't want to do anything with mental health. Get all your mental health patients out of the hospital. Okay, fine. Community-based mental health, huge investments going there. We're going to move the dollars there. If you don't want to provide the service, we're not going to pay you for the service. And so this is a great way to say the citizens come first. Community-based care comes first. And we get a better match with it the way I'm doing it with the federal government. They just want to apply political pressure and to drive more money into their system. But understand, the hospitals in New Hampshire make billions of dollars in revenue. Billions. We're moving about 25 million, not going to the state coffers, into community-based health, a fraction of a percent, to help the mental health centers, to help the federally qualified health centers, to help nurses get better pay. That's exactly what everybody wants. They just want to do it the old-fashioned way, but this is an awesome opportunity for New Hampshire.
You're an anti-tax guy, though. This is redistributive. You're taking the hospital's money and you're giving it to somebody else.
Well, that's the way it's always done. They wanted to raise the tax to 6%. I said, no, we're not raising taxes. They get taxed. It gets matched with federal dollars, and a percentage always comes back. I was willing to compromise at 91%. That's what they got last year, right? It's more money than they've ever gotten, way more than they ever thought they'd ever get before, and it still wasn't enough. And I said, either take the compromise in the legislature, or we're going to go back to 80%, which is more appropriate and allows more financial opportunity. They didn't want 91%. They didn't want... We offered them more than they got last year. They said no. Okay, fine, we'll do it this way. And so I think it's great. I think people should be really excited that we're not doing it the old-fashioned way. We're not, just, again, trying to drive everyone to emergency rooms anymore. You have all these emergent care centers all across the state, all this opportunity. We want healthcare workers spread out. We want them in our counties and our communities, better connection. I think it's just awesome.
You mentioned the rural healthcare has obviously been an issue. In particular, these maternity care deserts. And this is an issue that's happening across the United States, but in particular, New Hampshire. You talk a lot about, early childhood intervention, adverse childhood experiences. It seems like it's, the beginning of those bad things happening in some ways could be, mom having to drive 2 hours to get an OB appointment. Is there more that needs to be done on this? Not just the next governor, the next legislature.
Well, the key was some of the lack of services in rural areas, which is a real serious issue. It's about health, it's about workforce, right? So the fact that when I became governor, they said, you'll never be able to pay nurses in the Medicaid world the same as a typical market rate. But now we're actually going to be able to, in next month, we're going to bring contracts to the Executive Council that move a lot of those rates close to a market rate, something we were told could never happen. That allows the co-auses and the Graftons to kind of attract those nurses, attract those social workers, those healthcare workers that they typically weren't able to attract. In theory, hopefully closing some of those gaps in terms of the rural specialization that we want to see.
The abortion issue, obviously, it's an election year that's coming back in a big way. Your party is announcing it wants to go on offense here and start educating people about what the law in New Hampshire really is. Do you think that's trouble for them, though, because the party platform is still, quote, we support the preborn child's fundamental right to life and personhood?
No, well, nobody cares about party platforms when it comes to voting. The laws in New Hampshire on abortion are similar to pretty much every state around us. None of the Republican candidates want to make any changes to that. The Democrats have no real issue. They're trying to scare people on it a little bit, and I think the Republican Party is simply saying, look, it's really simple here. Our laws are basically the same as New York and Massachusetts. It's a lot of flexibility with reproductive rights. We respect that. We want to maintain it, and we don't want to change it. Democrats are trying to scare everybody, into thinking something drastic is going to change. But both Republican candidates running for governor are just like me. They're like where I am in terms of the law is good. We're not making changes. Let's focus on keeping New Hampshire successful with the economy and opportunities locally and limited government and low taxes. All those things that make us great. It's not that we don't care about that issue, but that issue's settled, and we're not looking to change it.
And the state just filed a lawsuit against TikTok. Where do you draw the line between, the public square, free speech, and when people start harming children?
So I'm a data guy. So one thing I give our Attorney General, John Formella, a lot of credit. He made sure his team looked at the data, and it's clearly driven by data that there was manipulation, targeting of children, that clearly had negative adverse effects in terms of mental health. It could be body image issues for young women, peer pressure issues and bullying for young men, all across that spectrum. So they looked at the data, and that's what you have to go on. I mean, it's a gut feeling that when you look at social media, you go, something ain't right here, right? Something is not right. But they got into it, and we're one of the first states to kind of lead the charge on it. I think it's the right thing to do. And again, I think TikTok is going to be around for a while, as is Facebook and all these other social media sites. I think young people are making the fact that I just brought up Facebook right now because it's kind of old school. But they're going to be around, so let's make sure that they're accountable, they're responsible, and they know that we're going to hold them accountable to bad practices.
I want to wrap up with voting rights. You've got a bill headed to your desk that would end all exceptions to the voter ID law. The affidavit ballot thing went into effect and seemed to work pretty well. Is it worth tightening the knot a little bit more on voter integrity?
I don't mind the law, but I don't like the timing. To do something like that with only a couple months to go before the primary and what is likely to be a close and contentious presidential election, to get everybody trained in terms of a new system, that's my biggest concern. So I'll take a look at it. It's not quite made it to my desk yet, but the implementation, I'm the CEO, I'm the executive, I'm the manager. I got to make sure that what we do can be achieved, and that's what we're looking at now.
All right, Governor Chris Sununu, thanks for your time on
Thank
CloseUp.
you.
We appreciate it. That wraps up this edition of Close Up New Hampshire. Thanks for watching. Make sure to check out the politics page on our website and mobile app for more in-depth analysis and to sign up for our weekly newsletter. We'll be back next week. Have a great Sunday.